This video discusses fluids and electrolytes and their critical role in maintaining body function and health. Intravenous therapy is an effective way to directly supply fluid into the intravascular compartment, producing a rapid effect and allowing for the injection of large volumes. Water is vital for transporting nutrients and waste, facilitating cellular metabolism, acting as a solvent for electrolytes, maintaining body temperature, aiding digestion, promoting elimination, and acting as a tissue lubricant. Body fluid consists of water and dissolved solutes, including electrolytes. The 604-020 rule defines body water as 60% of body weight, with 40% being intracellular fluid, or ICF, and 20% being extracellular fluid, or ECF. Total body water, or TBW, is about 60%. ICF accounts for 2/3 of the TBW, and ECF accounts for 1/3. ECF is further distributed into interstitial fluid, intravascular fluids, and transcellular fluid. Fluid content varies with body fat. Lean tissue is water-rich, while fat cells contain little water. Higher body fat content means a smaller percentage of total body water, which is also seen in older individuals. Diffusion is the passive movement of molecules. Filtration involves movement across a membrane due to pressure. Osmosis is the diffusion of solvent into a higher solute concentration. Osmotic pressure is the pressure that opposes this movement. Osmolality is defined as the number of solute particles per kilogram of solvent. Osmolarity is the number of solute particles per liter of solution. Since volume changes with temperature, osmolarity is temperature dependent. Colloids are large molecules, such as plasma proteins, that cannot cross biological membranes. These molecules exert pressure called colloid osmotic pressure, or oncotic pressure. Tonicity describes the effect of fluid on cellular volume, defined by the electrolyte concentration of the IV solution. Solutions are hypertonic, hypotonic, or isotonic, such as 0.9% normal saline. Intravenous fluid therapy is indicated for conditions like coma, severe vomiting or diarrhea, dehydration, shock, hypoglycemia, and as a vehicle for various medications, including TPN. The advantages of IV therapy include accurate and controlled administration, immediate response due to direct infusion, and prompt correction of serious fluid and electrolyte disturbances. Disadvantages include higher cost and the need for skilled supervision and asepsis. Improper use can lead to serious problems. It is contraindicated if the patient can take oral fluids or in cases of CHF or pulmonary edema. Complications can be local, such as hematoma and infusion phlebitis, or systemic, including circulatory overload, rigors, air embolism, and septicemia. Other issues include fluid contamination and mixing incompatible drugs. IV fluids are classified as maintenance fluids, which replace insensible losses, replacement fluids, which correct deficits from various conditions, and special fluids for targeted treatment, such as hypoglycemia or metabolic acidosis. 5% dextrose corrects dehydration, supplies energy, and is indicated for prevention and treatment of dehydration, pre- and post-op fluid replacement, and IV administration of drugs. It also helps prevent ketosis and corrects hypernatremia. 5% dextrose is contraindicated in cerebral edema, acute ischemic stroke, hypovolemic shock, hyponatremia, and uncontrolled DM. It should not be administered in the same line as a blood transfusion. Isotonic saline, or 0.9% nitrogen monosulfide, provides major extracellular electrolytes, correcting both water and electrolyte deficits, and increasing intravascular volume. It is contraindicated in preeclampsia, CHF, renal disease, and cirrhosis. Indications for isotonic saline include water and salt depletion, hypovolemic shock, alkalosis with dehydration, severe salt depletion, initial fluid therapy in DKA, hypercalcemia, and as a fluid challenge in prerenal ARF. Dextrose normal saline supplies major extracellular electrolytes, energy, and fluid to correct dehydration. It is indicated for conditions with salt depletion, hypovolemia, and correction of alkalosis. It is contraindicated in cardiac, hepatic, or renal failure. Ringer's lactate, or RL, is a physiological fluid containing sodium, potassium, chloride, lactate, and calcium. Lactate is metabolized in the liver to bicarbonate, providing buffering capacity, which rapidly expands intravascular volume. RL is indicated for severe hypovolemia, fluid replacement in post-op patients and burns, diarrhea-induced hypokalemic metabolic acidosis, and DKA, as it provides water, corrects metabolic acidosis, and supplies potassium. Contraindications for Ringer's lactate include liver disease, severe hypoxia, severe CHF, vomiting-induced alkalosis, simultaneous infusion of blood, and certain drugs like amphotericin and thiopental. Colloids are large molecular weight substances that remain largely in the intravascular compartment, generating oncotic pressure. They are more potent than crystalloids for volume expansion. Gelatin polymers like Hemical are sterile solutions of degraded gelatin with electrolytes, used for rapid plasma volume expansion in hypovolemia, volume preloading in regional anesthesia, and priming heart-lung machines. Advantages include not interfering with coagulation or blood grouping and remaining in the blood for 4 to 5 hours. Side effects include hypersensitivity reactions, and it should not be mixed with citrated blood. Contraindications for gelatin polymers include bleeding disorders, CHF, and impaired renal function. This section covers electrolytes. Electrolytes are charged particles or ions dissolved in body fluids. Major positive ions or cations include sodium, potassium, calcium, and magnesium. Major negative ions or anions include chloride, bicarbonate, and phosphate ions. This slide provides a placeholder for information about electrolyte functions. Sodium is the chief extracellular fluid electrolyte, regulating fluid volume and participating in nerve impulse transmission. It is eliminated primarily by the kidneys and is conserved by aldosterone. The normal value is 135 to 145 MEq/Ella. Potassium is the major cation of the intracellular fluid, regulating cellular enzyme activity and water content. It is vital for electrical impulse transmission, metabolism, and acid-base balance. The normal value is 3.5 to 5 MEq/L. Calcium is the most abundant electrolyte, necessary for nerve impulse transmission, blood clotting, and muscle contraction, and for strong bones and teeth. The normal value is 8.5 to 10.5 milligrams per deciliter. Magnesium is the second most important intracellular cation. It is involved in metabolism, protein and DNA synthesis, and maintaining electric activity in nervous and muscle tissues. The normal range is 1.5 to 2.5 MEq/L. Thank you for watching this video on fluids and electrolytes.